The different types of infertility I like to break into two basic categories, starting off with male factors and female factors. So we generally would like to see both a male and a female at the same time to explain this, and so they see the bigger picture and what we're going to need from each partner. Under the female factors, we're first looking at the quality of the egg, or if the egg is even being released. So this falls into something called ovarian reserve, whether it's good reserve or it's diminished, as well as ovulatory factor if they're even releasing eggs on a regular basis. And younger patients usually have better reserve, and women that have ovulation dysfunction are pretty obvious that they know that they're not having their period on any regular basis. Other than that, we have pelvic factor, which would include things that are happening within their anatomy. So first being the fallopian tubes, so that's a pretty common place where we see problems with fertility. We need those tubes to be open, healthy, and functioning for the eggs and the sperm to meet. The other factor in the pelvis is the uterus. Some anatomic things like fibroids or polyps or scar tissue can form in the uterus, and we generally would not want them there before somebody's planning for a pregnancy. Women would not necessarily know they have this unless they had some testing to figure this out. And then also in the pelvis, outside the uterus and tubes, are sometimes a process called endometriosis and scar tissue formation. Everything in the men is generally related to how much sperm is actually coming out of the ejaculate and if the male is able to produce an adequate sperm sample for us to evaluate. So it's relatively simple for them to come to do a semen analysis, and based on the numbers that we find, we kind of dissect out where we think there may be a problem with the male. Then there are couples that have seemingly everything seems to be working just fine, and we call that an unexplained infertility. And oftentimes, after we spend time with them and know the couple and we do their workup, we end up finding that it is some combination of possibly some endometriosis, some fertilization factor where the egg and sperm are where they're supposed to be likely, but for whatever reason they're not able to meet and fertilize. And then there's the, we wish we can give you an answer and we don't have it. And sometimes stress or lifestyle or whatever psychological things are happening within the couple could fall into that.